Gonna give it another minute here as people are joining us, folks. 30 seconds. Okay, I'm going to go ahead and get started. Welcome to today's media briefing, and thank you very much for joining us. I'm Laura Tollen. I'm a senior editor at Health Affairs, and I'll be hosting the briefing today. Today, we're very pleased to bring you the experts from the Centers for Medicare and Medicaid Services National Health Statistics Group in the Office of the Actuary. The team is going to be presenting the latest data on national health spending through 2023, which we will be publishing today as an ahead of print article for our January issue. The article is embargoed until 4 o'clock Eastern today, and more details on that coming up. But again, embargoed until 4 o'clock Eastern today. The CMS Office of the Actuary produces these annual historical data as well as spending projections for the country. Those usually come out in the spring, and the annual paper, the look back paper, comes out in December. And so today we'll be reviewing the historical data, again, looking at 2023. These spending projections are an the historical data are an enormous undertaking and really are considered the gold standard in US healthcare spending data. We're very proud to present this work again this year, and we're proud of our longstanding relationship with the staff at the National Health Statistics Group, which actually goes all the way back to Health Affairs' first year in action back in 1981. Attendees today will be able to get a copy of the article prior to the embargo by contacting Health Affairs. And I'm going to actually turn it over to my colleague, Emily Zeigenfuse, for a minute here, Senior Director of Marketing and Digital, and she'll say a few words about that.
Wonderful. Thanks, Laura, and welcome everyone to our media briefing. If you would like to receive a copy of the report, you can reach me at press@healthaffairs.org. I'll put that in the chat so everyone can see it. If you have any questions about the contents of this study or would like to speak to one of the authors, please reach out to CMS, and I will include that link in the chat as well. As Laura noted, the study is embargoed until 4 p.m. Eastern time today, which means that your story should not publish until 4 p.m. Eastern time today. If you have any questions that we can help with, again, that's press@healthaffairs.org. Feel free to reach out, or Christine just put in the CMS contact information to the chat.
Great, thank you, Emily. We are now going to turn to reviewing the findings from the paper. The study authors are all from the National Health Statistics Group, Office of the Actuary at CMS. Ann Martin will be the one presenting the findings today, and then all of the other authors, as well as the rest of the team, will be available for questions. So a quick introduction of Ann. Ann is an economist in the National Health Statistics Group. She works primarily on the historical and state-based national health spending estimates, and she earned a bachelor's degree in economics from the University of Maryland, Baltimore County. And with that, I can turn it over to Ann.
Okay, thank you, Laura. Thanks everybody for joining us today. My name's Ann Martin, and I'm going to be presenting to you the findings of our National Health Expenditures Report for 2023. So this first slide lists out our key takeaways and our main findings in our report. So total healthcare spending reached $4.9 trillion, or $14,570 per person in 2023. And as a share of the total economy, health spending accounted for 17.6%. The rate of growth of health spending in 2023 was 7.5%, which was faster than growth in 2022. Much of the growth came from faster growth in spending for private health insurance, which increased 11.5%, and Medicare, which increased 8.1%. For Medicaid, although spending and enrollment continued to increase, the rates of growth were lower in 2023 compared with 2022. Medicaid spending grew 7.9% in 2023 compared with 9.7% growth in 2022. And finally, the insured share of the population reached 92.5% in 2023, and that was primarily due to continued increased enrollment in marketplace plans, as well as Medicaid enrollment levels that remained high. This graph shows the growth in national health spending and gross domestic product since 2018, and it illustrates how volatile the growth rates have been for each since 2019, mostly for reasons tied to the pandemic. This report focuses on the growth in the red line, showing health spending increasing 7.5% in 2023. However, much of the pattern since 2020 is distorted by COVID relief funding, which is included in our measure of total health spending. COVID relief funding refers to supplemental federal funding, such as the Paycheck Protection Program loans and the Provider Relief Fund, and it also refers to federal public health activity associated with the COVID-19 pandemic. This additional federal funding contributed to a 10.4% increase in overall health spending in 2020. During 2021 through 2022, as supplemental COVID funding declined, overall health spending increased at lower rates of growth, at 4.2% in 2021 and 4.6% in 2022. In 2023, the public health emergency ended in May, and the spending levels for other federal programs and federal public health, which are the two NHE categories that contain the COVID relief funding, they returned close to pre-pandemic levels. As a result, the growth in healthcare spending in 2023 generally reflected increased use and intensity of services. When COVID relief funding is excluded from overall health expenditures, which is depicted in the green line, national health spending shows an increase of 9.3% in 2023. Because the supplemental federal funding is not included in the growth rate for this line, the pattern generally reflects an increase in the use of healthcare goods and services from 2021 through 2023, following less use in 2020. It also reflects increases in spending for health insurance, such as private health insurance, Medicare, and Medicaid. And furthermore, the acceleration in the green line reflects increased enrollment in private health insurance and Medicaid. So despite the volatile growth rates for NHE and GDP that we saw on the previous slide, which were due to a variety of economic and pandemic-related reasons, here we show on the left how health spending accounted for a similar share of the overall economy in 2023 as compared to 2019 or prior to the pandemic. During the height of the pandemic, and primarily due to increased federal COVID relief funding, the NHE share of GDP increased to 19.5% in 2020. However, as the supplemental federal funding subsided and growth rates for health spending came down, the NHE share of GDP returned to 17.6% in 2023, which was about the same share as in 2019, when it was 17.5%. In addition, looking at the chart on the right, over the entire period from 2020 through 2023, health spending and GDP grew at similar average annual rates, with NHE growth averaging 6.6% and GDP growth averaging 6.5%. This slide highlights trends for some of the main payers of healthcare on the left and the main goods and services on the right. Starting in the chart on the left showing the payers, we show the growth rates for Medicare, Medicaid, private health insurance, and out-of-pocket spending. The overall acceleration in national health spending growth was primarily due to the increase in private health insurance, which increased 11.5% after a growth of 6.8% in 2022. And it was also influenced by Medicare, which increased 8.1% following growth of 6.4% in 2022. This faster growth occurred mainly because of accelerations in the use and intensity of healthcare for the people who were covered by these payers. Medicaid still experienced strong growth, but it was at a slower rate than in 2022, increasing 7.9% in 2023 compared to growth of 9.7% in 2022, primarily because of slower growth in enrollment. For out-of-pocket spending, growth was fairly stable in 2023, increasing 7.2%. In the chart on the right, we highlight the growth rates for hospital care, physician and clinical services, and retail prescription drugs. While growth in spending for all three of these services accelerated in 2023, the increase in the rate of growth was the largest for hospital services, which increased 10.4% in 2023, following growth of 3.2% in 2022. For physician and clinical services, spending increased 7.4% in 2023 compared to growth of 4.6% in 2022. And these increases were both primarily attributable to growth in non-price factors, such as the use and intensity of services. Finally, spending for retail prescription drugs grew 11.4% in 2023, following growth of 7.8% in 2022. Rapid growth in the use of anti-diabetic drugs contributed to this increase. Additionally, the growth is due to factors associated with mix, which includes how many prescriptions are dispensed, whether they are brand or generic, and the price. In 2023, the number of prescriptions dispensed increased at a slightly slower rate than in 2022, but a larger proportion of dispensed prescriptions were for brand name drugs. Also, retail prescription drug prices overall increased at a faster rate, with brand name drugs increasing at a faster rate than generics. Moving on to enrollment, on this slide we show our enrollment estimates for the main payers as well as our estimate of the uninsured. One thing to note is that these estimates are not mutually exclusive and are therefore not additive. And this is because there are overlaps in insurance coverage. Another thing to note is that these estimates are averages for the year. And the takeaway from this slide is that over the past 4 years, there's been a steady increase in the insured share of the population, and it reached a high of 92.5% in 2023. This increase can be attributed to strong growth in private health insurance enrollment, particularly in 2022 and 2023, that was driven by strong increases in marketplace enrollment. Employer-sponsored private health insurance also contributed to the increase. In addition, Medicaid enrollment remained high at 91.7 million beneficiaries, which was on average 15.5 million more than those enrolled in 2020. And the boxes all the way to the right in gray show the one-year change in enrollment counts and collectively translate to about 1.7 million fewer uninsured individuals in 2023 compared to 2022. This chart shows the distribution and growth of spending by sponsor, or the businesses, households, and governments that are responsible for financing healthcare payments. The chart on the left shows the distribution, with the federal government making up the largest share at 32%. This share has been steadily decreasing since its record high of 36% in 2020, but it is still higher than its share of 29% in 2019. Households make up the second largest share, followed by private businesses, state and local governments, and other private revenues. In 2023, there was a slight downward shift in the federal government share to 32%, while at the same time, there was an upward shift in the state and local government share to 16%. The reasons for these shifts can be understood more by looking at the growth rates in the chart on the right. For the federal government, which is the red line, after a spike in 2020, growth was much slower during 2021 through 2023. This was primarily due to a continued decline in COVID-related federal funding. For 2023, a slowdown in federal Medicaid spending growth also contributed to this lower trend. Slower growth in federal Medicaid can be attributed to the ending of the continuous enrollment provision of the Families First Coronavirus Response Act. When this provision ended in March of 2023, the temporarily increased or enhanced Federal Medical Assistance Percentage, or FMAP, which had been increased by 6.2 percentage points during 2020 through 2022, was phased down, and states resumed their redeterminations of Medicaid eligibility, leading to slower growth in enrollment. For state and local government spending, which is the blue line, growth accelerated in 2023, and this was mainly due to faster growth in state and local Medicaid spending. The phasing out of the enhanced FMAP contributed to the shift between federal and state and local Medicaid spending, as the increased FMAP placed more financial burden on the federal government while it was in effect, but as it was phased out, the burden was partially shifted back to the states. 2023 growth also accelerated for private businesses, which is the green line, due primarily to increased contributions to employer-sponsored private health insurance premiums. And with that, thank you for your attention, and we will end the presentation and take questions.
Okay, great, thank you, Anne. So turning to the Q&A, or actually just first a reminder that these data are embargoed until 4 o'clock Eastern today. And yes, we're now going to take questions, and the way that will work is use the raise your hand function. And I hope and I believe that I will be able to see that, and I'll call on you. You can also put a question in the chat and I'll read it if that works easier for you. I would ask that when you ask a question, please be sure to state your name and your publication prior to asking the question. And remember to take yourself off mute. So with that, let me pause for a minute and see if there are any questions coming in. Don't see any yet. Okay, well, I'm gonna, I'll take the moderators. Oh, actually, I do see one. I'll come back to my moderator's prerogative afterwards. We'll start with Joyce Frieden. Don't forget, unmute. There you go. Yeah.
Yeah, hi. Joyce Frieden from MedPage Today. Just wondered if there was anything you could elaborate on regarding the growth in cost of physician services. I heard you mention intensity. Is there anything in specific that you could say about that and why it was higher than the previous measurement?
Well, for physician and clinical services, the rate of growth was 7.4%, which was an acceleration. However, price growth was low and steady between the 2 years. Prices only increased 0.6% as compared to 0.5% in 2022. And the way our analysis is set up, we break it down into price and non-price factors. So since the price was steady, basically the acceleration is attributed to use and intensity increasing. And a lot of that is through private health insurance and Medicare. And I didn't know if anybody else had anything to add to that. We have our team with us who can jump in if they have any more to add.
Yeah, so this is Ben Washington from CMS. As Ann mentioned, we did see an increase in private health insurance spending and also in Medicare and out-of-pocket spending. And also we did notice some anecdotal information regarding use for physician services, that there was a high flu season in 2023. So that could contribute to some of the use increase that we're seeing.
Okay, thank you.
Thank you.
The next question is from Nicole DeFutis.
Yep. Hi. Thanks for taking my question. I was wondering if there are any numbers you can provide or any color you can give on how much weight loss and diabetes drugs contributed to that faster growth of prescription drug spending that you saw, and whether you expect that trend to continue.
We don't have specific numbers on that, but they did contribute to the overall increase in 2023, specifically, well, actually for private health insurance, Medicare and Medicaid. It was a factor in all three payers. So we don't have that exact estimate, but what we do know is that for Medicare Part D, that brand anti-diabetic per member per month allowed charges increased 35% in 2023. And that significantly contributed to Medicare prescription drug spending growth of 12.2% reported in this analysis.
Thank you so much.
Okay, I'm going to take Maya and then Harriet, and then I will get to these questions in the chat. I see them. Go ahead, Maya.
Hi, thanks for taking my call. This is Maya Goldman from Axios. Can you give a little more context into the increase in hospital spending or share of hospital care as national health expenditures? Seems like a pretty big jump. Thanks.
Yeah. I can start, like, and then if Micah wants to jump in. So hospital spending increased 10.4%. That was a much faster rate of growth than the 3.2% in 2022. That was driven by the increases in private health insurance, which increased 13%, and Medicare, which increased 6%. And that was largely related to increases in the use and intensity of services. So another impact in 2023 that we saw was due to strong growth in other private revenues. And that's partly due to strong investment returns during the year. For increased use and intensity of services, we do have data showing that hospital discharges grew 1.6% after declining 1.3% in 2022. And we also found that Medicare hospital outpatient use increased in 2023. Price growth was stable, increasing 2.7% in 2023 compared to 2.8% in 2022.
Thank you. I'm going to go read one of the questions from the chat next, and then I will come back to Harriet. I think I'm getting these in order. I'm trying. The question is from Richard Payerchin, probably saying that wrong, from Medical Economics. Do you have any breakdowns of data to indicate changes in annual spending on primary care versus specialty care for physician services? And thank you for the presentation.
We don't, correct, right, Ben?
Yeah, unfortunately, we don't have that breakout currently, but that is something that we are in the midst of researching and hope to be able to include with our estimates in the future.
Thank you. Let's go to Harriet's question. Oh, do we lose? I think we might have lost Harriet. All right, Bob.
Sorry, I'm sorry. Can you hear me now?
Yeah, go ahead.
Guys, I don't know what happened there. Yeah, I just wanted to ask about just a broad sense on why this annual growth in expenditures is so much stronger in 2023 than it was, the prior year, but also pre-pandemic trends. I mean, we're seeing like pretty big increases in a lot of areas, like as we already mentioned, hospital care, but also professional services. I'm just curious, does this reflect the fact that people are starting to go to the doctor again because the pandemic's over and they're catching up, or is this due to higher prices?
Okay, so that's a really great question. So we did show that even though after this period of volatility in health spending growth from 2020 through 2023, the healthcare share of the economy was similar to the share in the years leading up to the pandemic. However, we do show higher growth on average than prior to the pandemic. And I can go back to the growth slide. So this is showing the average growth being similar to GDP and the shares being about the same prior to the pandemic and in 2023. But we do show this volatile pattern, and you do see that in 2023, the growth rate did increase 7.5%, and that was the highest increase since 2003. So as I mentioned in the presentation, the higher growth was due to a combination of factors such as increased enrollment, and that was mainly due to legislation enacted during the pandemic, leading to increased enrollment in Marketplace and Medicaid. There was also increased use and intensity of services, which was kind of across the board, which includes post-pandemic rebounds after a dip in use during 2020. And it also includes the increases in spending for health insurance, specifically for private health insurance and Medicare. But prices did not necessarily contribute to the higher growth in 2023. Prices did increase 3%, according to our NHE deflator, but this was fairly steady compared to a 3.1% increase in 2022 in prices. Also, prices for healthcare increased at a slower rate than overall economy-wide prices in 2023. General inflation in the economy increased 3.6%. But when you look at a 3-year average of price growth and compare that to recent history, average price growth for 2020 through 2023 was higher than in the years prior to the pandemic. Average medical prices increased 2.6% from 2020 through 2023, and that's compared to 1.4% from 2016 to 2019. And this stronger increase in these years, 2020 through 2023, was influenced by high economy-wide inflation, which increased on average 4.1%. So the medical sector did not see the same type of price growth as the overall economy in the last few years, because the health sector typically lags behind growth in the overall economy because it's somewhat insulated due to the timing of contractual agreements between insurers and healthcare providers. I hope that kind of answered your question.
Yeah, can I just follow up with one thing?
Sure.
From what I can tell from the report, 60% of people get health insurance through their job. Does that match with your estimates?
We have employer-sponsored private health insurance estimates of spending. I don't know if we have the actual enrollment numbers. Does anybody on the team know?
Yeah, Dave, do you happen to have the enrollment table that we're?
Yeah, I'm gonna pull it up.
Table 17.
Oops.
Dave, do you want me to go on to the next question and circle back, or are you?
Yeah, just give me 1 second.
Okay, we'll wait.
So total employee sponsored was 175.6 million folks in 2023.
Okay,
Out
so
of-
that's about half of the population, right? If the population is 334 million, according to Exhibit
Yeah, a little, yep, a little bit more.
Okay, thanks.
Okay, thanks. Let's go on to the next question, Bob Herman. And I'm just a reminder, if you're asking your question out loud, please tell us what publication you're with.
Hi, this is Bob Herman with STAT. Just had a question about the Medicare spending growth. To what extent is Medicare Advantage included within those figures, namely any overpayments tied to risk adjustment and any rise in quality bonuses? Thanks.
Yes, so our Medicare estimates include both the fee-for-service and Medicare Advantage portions. So, and everything that goes into the Medicare Advantage rate setting and payments is included in our numbers.
So can you give like any color in terms of how much maybe risk adjustment and quality bonuses factored into the overall higher spending growth?
That we don't have. We just have total Medicare Advantage spending, and we break it down. The furthest we break it down is by type of service. So unfortunately, no, we don't have that. All we can do is say that those are drivers of spending growth.
There actually are a couple of papers coming out in the January issue of Health Affairs that address that question. So I encourage folks to look at that. It's kind of an aside. Let me go to, you can continue raising your hand or put questions in the chat. I'm going to go over to the chat right now. The next question is from Jesse Hellman from CQ Roll Call. The question is, what programs saw the highest increase in drug spending or in spending on diabetes drugs?
We don't have spending broken down by type of drug. We do have prescription drug overall estimates broken down by type of payer. So I think all for the payers within prescription drugs, I think all saw an acceleration, and all of it is partially attributed to this faster growth in the anti-diabetic drugs. So let me see. Yes, private health insurance increased from 3.5% to 13.8%. And this is for the prescription drug sector. Medicare increased from 9% to 12.2%. Medicaid continued to experience strong growth, but it actually slowed. It went from 15% growth in 2022 to 11.7% growth in 2023. There is Medicaid data available on the CMS website that people, if they're interested in doing some analysis on, but that's not part of this study.
Thanks, Anne. All right, the next question is from Meryl Guzner. I'm not seeing the publication. Maybe it'll get dropped in the chat. The question is, what accounts for the slower growth in Medicare spending per enrollee versus significantly larger growth per enrollee in either private insurance or Medicaid? Goose News, that's the publication.
Yeah, this is Aaron Catlin at CMS. So we can look at spending by the payers and programs that pay the final bill, such as, PHI, Medicare, and MA within Medicare. And we can also look at it by sponsor, the entities that are responsible for financing that healthcare. But what's difficult to do is to compare spending trends across payers and programs, because they tend to have very different covered populations, different covered benefits, and the population makeup tends to be different. So it's hard to make those comparisons with our data.
Thank you, Aaron. Next question is from Susan Morse, Healthcare Finance News. Is the increase in ACA plan participation related to redeterminations in Medicaid?
Yeah, this is Aaron Catlin again. So what we can measure and what we have estimates for is we do have estimates for Medicaid enrollment. We also have estimates for marketplace plans. As Ann mentioned, those estimates are not additive, and what we can't do is follow the movement of those enrollees as they would move from, say, one type of insurance to another. So we have the estimates, we can look at the trends in those estimates, but we can't follow individual people that could be, moving from, say, Medicaid to a marketplace plan or something like that.
Thank you.
Let's go now to Nicole DeFutis again.
Hi, thanks. I just have a quick follow-up question. I'm with Endpoints News. I just wanted to clarify, when you say prescription drug spending increased to $449.7 billion, who does that encompass? Does that include all spenders from Medicare and Medicaid to private insurers to beneficiaries, or is that just CMS spending?
Oh, yes, it is definitely all payers, including out-of-pocket. So beneficiaries, the payers, private health insurance, Medicare, Medicaid. Our accounts are set up so, like, if you look at type of service, it lists the payers underneath of that. It's a matrix, so it can go either way. You can look at the payers by service, or you can look at the service by payers. And so, yes, it encompasses everybody.
Okay, so it's total national.
Yes.
Thank you so much.
Okay, thank you. Next question in the chat, Paige Minemeyer from Fierce Healthcare. Do you have any color on the impact that enhanced ACA subsidies may be having on health spending?
Well, we don't have the figures, but we do have, like Aaron mentioned, the enrollment estimates, and that showed an increase over the last 3 years, and that is driving the overall increase in private health insurance enrollment, as well as contributing to the spending increase. And that's mainly because of the enhanced subsidies that were made available by the American Rescue Plan Act of 2021, and that were renewed under the Inflation Reduction Act of 2022. So those enhanced subsidies did lead to increased enrollment in the marketplace.
Great. So I'm not seeing any other hands up or questions in the chat. Let me do last call here. All the questions I was going to ask have been asked, so thank you all for that. Going once, going twice. Okay, going 3 times. All right, well, we're going to wrap up then. Just again, as a reminder, the paper, the data are embargoed until 4 o'clock Eastern today. And if you want to receive a copy of the study, email Health Affairs Senior Director of Marketing and Digital, Emily Zeigenfuse. The email address is in the chat, but again, it's press@healthaffairs.org. And if you have any questions about the contents of the study or would like to speak with one of the authors, please reach out to CMS at the link, which is also in the chat. Thank you again to CMS for presenting the data and for your ongoing partnership. We're thrilled to have you here, and thank you to everyone for attending today's briefing. And with that, we are adjourned. Thank you.
Thank you.